Hi, Mr. Smith. I'm Angie. I'm going to be your nurse today, and you must be Mrs. Smith?
Yes, nice to meet
Hi,
you.
nice to meet you. Mr. Smith, we're going to be bringing in the doctor, Dr. Perrinet, to talk to you about that triple lumen catheter, that central line that she wanted to insert on you today. Okay, she'll be coming in to talk to you and your wife and answer any questions that you might have about that procedure.
Hi, Mr. Smith. How are you? Hi, Mrs. Smith.
Hi,
Nice to meet you.
Thank you.
So today we're going to put in a central venous line, okay? And that's because your blood pressure is a little low and we need to give you some medications, but we can only do them through a larger IV. Now, I just want to tell you a little bit about this. Complications include bleeding, infection. We dress up in a sterile gown, wear masks, and we do clean the area. We put a special dressing on over it to minimize infection. We do this under direct ultrasound guidance to minimize any complications. Do you have any questions about this procedure today?
I don't think that I can think of right now.
Okay. Would you still like the procedure done today?
Yeah, he's pretty sick.
Okay. So we'll go ahead with the paperwork.
Thank you.
Mrs. Smith, do you have any questions for me about anything that she talked to you about?
I really can't think of anything right now. Just so worried about him.
Okay, I have some information that I can provide you about central lines. You may not have any questions now, but later you may think of some things that you might want answers to. And these forms will help you with that. If you have any questions about these, I'll be sure to talk to you about it now or later. Okay? This is just information regarding central lines, bloodstream infections.
Okay.
Okay?
Thank you. You need me to sign that, okay?
And this is the Mrs. Smith. So if you could just be signing here, and this is just stating that Mr. Smith is going to have this procedure done on this date at this time by myself, and we're doing this so that he can get the medication he needs.
Okay. What's today's date?
The 19th.
19th. Okay, thank you.
Please.
Mr. Smith, I'm just going to check your name badge one more time as I prepare my paperwork for the procedure that we're going to do with the doctor, okay? Okay, thank you, sir. We'll be back in with the physician soon. I've identified that this is Jason Smith. The procedure is going to be a central venous catheter placement. The verification of the site inside, that's not applicable in this case. And I have all of my items available that I need to perform this procedure in my triple lumen catheter insertion kit. I'm going to start my central line insertion documentation. The indication for insertion of the central line is a vasopressor infusion. This is the 6-Ashman ICU. Type of line is a central line. Will be a triple lumen, and the location I'll put later. This is not going to be a femoral line. Is this a new line? Yes. Ultrasound will be used. Yes. And I obtained consent. The name of the physician is Dr. Perrinet. And my signature. Today's date is 04 or 09/19/13, and the time is 12:15. Mr. Smith, Dr. Perrinet and I are going to be preparing you for this procedure that we're going to do today, for this catheter insertion, okay?
Mr. Smith, I'm just gonna lie you back for one moment. Thank you.
You're just raising your bed. Thank you. I brought your size 7 gloves.
Thank you very much. Would you be able to hand this to me? Once I get back in shape, as well as using my little stuff. Thank you. you're just gonna feel a little bit cold and wet. This is just to clean the area.
Good.
See, sir, this is just another sheet to keep the area clean. It's gonna go a little bit over your face here.
Let's do our timeout. I'd like to start the timeout. This is Jason Smith. Jason Smith, date of birth 04/09/1981. Does everyone agree?
Yes.
The consent reads, Dr. Perrinet will perform a central venous catheter placement. Does everyone agree?
Yes.
Dr. Perrinet, please complete the last call.
This is the last call on Mr. Smith for central venous line placement.
We have identified the patient using his name and date of birth. We verified the procedure and the accurate consent form. And we verified that she is going to the right IJ triple lumen. That is correct. This completes the last call. Let's begin.
Good, start.
perform
Tuesday, that's
a
the what,
right
24th?
IJ triple lumen catheter. We participated in the timeout. We performed hand hygiene. This was a dry site. This is NA. We used a large drape. We wore sterile gloves and a hat, mask, and a gown. Maintained a sterile field. There was no assistant.
I think it's going really great, and we'll get together Tuesday at some point and
Yes, we all wore a mask. Sterile technique was applied when applying the dressing. The dressing was dated. The swab caps were applied. The bio patch was applied. And the central line tip was confirmed by x-ray, and I received an order from Dr. Perrinet that the triple lumen catheter was okay to be used.